Hello, my name is Trace Box. I'll be doing the cue cards on fluid, electrolytes, and burns. So we're gonna start with fluid and electrolytes. Um, the first topic is FVE, which is also known as fluid volume excess, which is defined as too much fluid in the vascular space. Two causes of this are heart failure and the renal failure, which renal failure is your kidneys aren't working. Three things with sodium: you have canned goods that contain sodium, effervescent soluble medications, and then you have IV fluids with sodium. Some of the diseases with too much aldosterone would be Cushing's, which is just too much of all steroids. And then you have hyperaldosteronism, or you have cons, is the other name for that. And then diseases with too little aldosterone is Addison's disease. Next, we have ADH, which is just water. It retains water. It doesn't diurese. Too much ADH, they have the word SIADH, and to remember that, too many words, too much water, and for that, the blood is concentrated, and then, or no, the blood is dilute, and then the urine is concentrated, and then vice versa. For too little ADH, you have your urine is going to be dilute, while your blood is going to be concentrated. And for that, you think of diabetes insipidus, and we did the DI, which means diurese. Some key words to look for problems with ADH would be like craniotomy, head injury, sinus surgery, transfemoral hypophysectomy. And then some signs and symptoms of fluid volume excess would be lung sounds are wet, polyuria, and weight increase just because there's too much fluid in the vascular space. Some treatment for fluid volume excess or hypervolemia would be a low sodium diet, and you would want to restrict fluids. You would want to make sure you get INO and daily weights. They do have some diuretics to treat, but of course you don't want to do diuretics right away. You want to focus more on things and have medications last. But some of them would be furosemide, butenamide, hydrochlorothiazide, and as well, you do want to use potassium-sparing diuretics because you are losing potassium when you do retain that sodium in water. For aldosterone and ADH, you retain water, so you'd want to use a potassium-sparing diuretic such as spironolactone. Now moving on to burns, we have basically most burns do occur in your own household. We want to worry about shock because you're losing fluid, and losing fluid, your blood pressure goes down, and if your blood pressure drops too much, you will go into shock. So we do need to worry about that. The cardiac output decreases because you're losing all that fluid, so your body's basically trying to hold on to that fluid you have left in the body. Why is epinephrine and norepinephrine secreted? It's to vasoconstrict your blood vessels so that you do hold on to the fluid, and it's trying to stop you from going into shock. Why are ADH and aldosterone secreted? Those are secreted to retain water and sodium so you can keep your fluids in. Number one cause would be inhalation injury. For like burns specific, you would want to focus on clearing the airway first. If there's any airway problems, you want to make sure that you take care of that first. One test taking strategy for burns or for in general, is to do the least invasive first. Some indicators for inhalation injury would be things like singed nose hair, singed facial hair, soot on the face, difficulty breathing, difficulty swallowing, wheezing, and hoarseness. That's it. Thank you.